There's a number of technologies that I'm going to discuss. As far as diagnosis, I'll touch briefly on endobronchial ultrasound and bronchoscopy. Dr. Paul, a pulmonologist, is going to spend a lot more time on those techniques. Our latest advances are with electromagnetic navigation, both used for bronchoscopy and percutaneous needle biopsy, with equipment that's very portable and user-friendly, and allows procedures to be, multiple different types of procedures to be performed with a single set of equipment and in a single room and even in a single setting. So whereas, we now have patients who thought maybe they might have a needle biopsy to diagnose a lung tumor. If that comes back negative, we can move and immediately biopsy their lymph nodes, or assess it endobronchially as opposed to percutaneously. Whereas those was before 3 separate procedures done on different days and maybe took a month to get through them all. Now we can do them in a single day. And I'm going to talk about standard minimally invasive surgery, and then a little more of a focus on robotic surgery and the advances that brings in terms of the complexity of the operations that we can perform minimally invasively. And then finally, for palliation, the technologies for the most part are fairly basic, but the emerging technologies have to do with laser therapy for ablation of tumors, opening up of airways, whereas before we would have to use hardware like stents and foreign materials that require a lot of maintenance. Now we can actually vaporize tumors and then they actually go away, and it's a much more natural form of breathing and a much smaller impact on people's quality of life.